All right, we have 1 minute left. All right, about to start the webinar now.
Welcome, everyone. I hope you have your midday coffee, tea, or beverage ready. And if not, it's okay. You have a few more moments to go get them, as we're going to give just a few more minutes for individuals to join us before we begin. So that even means you can grab your snack and enjoy it during this hour. Welcome again. My name is Stacy Lawrence, and I'm part of member engagement team here at Partners. Thank you for joining us today for our monthly Partners Member Cafe. It is a safe place for you to voice your concerns and learn more about resources and services. Also joining us for member engagement is Terry Christie, the behind-the-scenes Zoom producer, and Stacia Bonner, who will be entering important information into the chat for you to copy and paste. And Beth Brooks will be moderating the questions and answers that the audience may have for us. Our topic today is tools you can use for back to school. Before we go into our session today, let's go over a few housekeeping items. We are offering today's session in closed caption. You will see controls for this feature at the bottom of your screen. You can simply hover over live transcript to make changes to meet your needs. Unfortunately, we are unable to accommodate AI note takers within Zoom due to cybersecurity reasons. We will have to remove them as attendees. Please accept our apologies for any inconvenience this may cause. This meeting is being recorded. Please do not share any personal information during our session. Partner staff is available for individual issues you may want to discuss. We will share contact information for member engagement later in our presentation. The recording of this session will be available on our website at www.partnersbhm.org. Type Member Cafe in the search bar upper right for easy location. We will also be sending you a follow-up email with slides and other materials. Now let's take a look at the Zoom features located at the bottom of your screen. Chat is open for engagement during our session. Q&A is open for you to enter questions as information is being presented. We will moderate questions at the end. Reactions, who doesn't like reactions? Reactions are available to send up positive emojis or to raise your hand during the question time, and we will open your mic for questions or comments. Survey. I always have surveys, right? So at the end of our session today, we will ask you to complete a survey. This information is very important to us. We appreciate you taking a few minutes to complete the survey. Now, bear with me for a moment. We have a couple of panelists today for our session. So up first is Alyssa Cunningham. She has her BA and MHFA and is the Community Engagement System of Care Parent Representative for Partners Health Management, drawing on over 7 years of lived experience raising a child with intellectual and behavioral challenges. Alyssa provides compassionate support to families navigating similar paths. She is deeply committed to promoting trauma-sensitive, family-driven services and connecting families with vital resources to improve outcomes and strengthen resilience. Douglas Carr. He has been in the social work field since 1988 and has been a school social worker in North Carolina since 2008. Douglas is the lead elementary school social worker for their team at Cabarrus County Schools. He currently serves 2 elementary schools in his district. And technically his district is our district with partners. Keisha Shamara Horton, she is a licensed clinical mental health counselor, a licensed clinical addiction specialist associate, and a licensed professional school counselor with more than 20 years of experience working with adolescents and adults. Keisha has gained extensive experience working with school-aged children and families dealing with life transitions, trauma, depression, anxiety, and family conflicts. She has a passion for helping adolescents and young adults overcome challenges to reach their full potential. She is the owner and executive therapist at Samara Cares Counseling and Consulting, PLLC, and the mental health clinician for Winston-Salem Forsyth County Schools. She guides her students and clients to pull from their own strengths and experience using many methods, including reality therapy, solution-focused therapy, motivational interviewing, and cognitive behavioral therapy. She is also trauma trained using the brain spotting treatment method to guide clients to identifying and processing their emotional and body pains. As a North Carolina native, she received her Bachelor's of Science degree in management from High Point University before earning her Master's of Science degree in school counseling from North Carolina A&T State University. She began her career as a professional school counselor in a local high school before pursuing her license in mental health and substance use counseling. She is also a youth mental health first aid provider with training in suicide intervention, career development, prepare, crisis prevention, and response, trauma resilient schools, and adverse childhood experiences, so ACEs. She has provided her consultation services to several youth organizations and nonprofit agencies in the community, including Green Tree Peer Support, Crosby Scholars, Turn Enrichment Program, Lead Girls, Salvation Boys and Girls Club, and the YMCA. Keisha is a proud member of, excuse me, Delta Sigma Theta Sorority Incorporated, where she enjoys serving her community and being a change agent in her spare time. She enjoys spending time with her children, vacationing, scrapbooking, and supporting the arts. All Greek love, Keisha. Rhonda Baylor, she has been a family partner advocate for 9 years at Partners Health Management. As family partner, she's lived life experience. Rhonda has a daughter who was experiencing difficulties in school, and she did not know how to navigate the system or systems. Today, Rhonda assists parents who are in need of advocacy and resources. She believes she can empower guardians through resources, advocacy, and her lived experience. All right, you guys, those are our 4 panelists, and we're about to start our questions. I hope you guys are ready. Question 1, what tools do parents, caregivers, and their kids need to get ready to go back to school? And I'm gonna throw this to Keisha because she's right beside me in the squares that I see.
Well, outside of, school supplies, right? Like every school, if they haven't already started, they're getting ready to get started. And they're usually publicizing their school list. on their website, Canvas, or even I saw a school list for our district in Walmart recently. So outside of school supplies, I would say start establishing routines. That is a huge tool for students. They need routines. They need to know when it's time to go to bed and when it's time to wake up. We shouldn't wait, of course, until school starts to start establishing these routines. I know summertime can be a little lax, and that's understandable, but routines are important to help students prepare for school, and also making sure that they are emotionally ready, setting those emotional boundaries, making sure they know where their safe spaces are, and continuing to equip them with what they need to be successful.
Awesome. Is there anyone else from the panelists who would like to answer that question? You want to add to what Keisha has just told us?
I would just add,
Sorry, go ahead.
there was something, it was a creative idea that I found on the website. And I thought it was hopeful to share with the panel. Creating it's a 7-day countdown, tools you can use for back to school. And what you do is you put these notes in the jar, and it could start off with the first day could be just when you go back through your the list of supplies, and you and your parent could go through that, just pick out the favorite supplies that you want to do. Another thing in there was it was a celebration night, a blessing night, a night where you pick out, and this is like 7 days before school start back. And I just wanted to add that that's like a fun, a creative idea that you can do with your child if you have the time. I do know that parents are busy schedules. But in my experience, I've often found that parent steady routines, nutritious of healthy meals and preparation has pairing those with I'm getting nervous, I'm sorry. But pairing those with these simple conversations with just talking to your child, asking them how you feel about school, asking them, how can I help you? Or, what are you excited about school? Just pairing that with those ideas, I think that it would help a child to be ready and prepared to thrive.
Douglas, I saw you come off. Go ahead.
Yeah, so I would just had a couple things. Number one, for the parents, that sometimes we have parents that didn't have a great school experience themselves. So having a good attitude starting school and being excited for the kids, and that kind of will relay to them, to the students before they start. So kind of having that good attitude, becoming familiar with the school that they're getting ready to go to. So know who the people are that can support them. Learning who the principal is, who the counselors, the social workers, the teacher. If you can get to the school and meet your teacher ahead of time, make sure your contacts are updated. So if the teacher needs to contact the parent, they have that, because sometimes we know, phone numbers or emails and things like that change. So just some of those logistical things are very, very important. Um, you know, to help your child be ready. Uh, Health, keeping, like, having the shots updated or anything medical they need. Those are important tools to use before the kids start school. So just a couple more things to add there.
Awesome. I cannot agree more with you on that one, especially those shots and things, and making sure that they are ready. You guys answered that question really, really well. Awesome. Did anybody else have anything to add?
Yes. Getting the child ready during the summer months, at least 2 to 3 weeks before school starts, especially with that bed schedule. Because, during the summer, they stay up late and wake up late. So getting them prepared for bed early, at least 2 to 3 weeks before school starts.
Gotcha. I think we're right in that window, right? So school is getting ready to start back.
Yeah.
We're in that 2-week window. So now is that good opportunity to go ahead and get them babies in bed at a good hour so they can get up early in the morning to get on to that routine. I heard that was the consistency with multiple of you. Having that consistency and that routine just seems to be really, really important. Awesome. I'm going to go on to question number 2. Anybody else have anything to add to question 1 before we go? All right, question 2. What can parents or caregivers do at home to help kids show up at school focused, energized, and ready to learn? And I'm gonna throw it to Douglas.
All right. Well, some of them were actually already mentioned in the first question, but for the elementary level, well, even in high school and middle school, a regular bedtime, morning routines. I mean, those things, kind of speak for themselves. And I know sometimes at the elementary level, if the parents will have the clothes laid out the night before, the backpack ready the night before. Sometimes letting the kids pick out what they want to wear on those first few days of school, that little bit of power kind of gets them excited about that next day. Reading to the kids each night, in their home language or whatever it is, because those can lead to important conversations. Just reading books can lead to important conversations about what may go on at school during that day, or just different topics that the kids want to talk about. So I think those are just, they seem very simple, but that routine and that communication is extremely important.
Awesome. I love it. Anybody have anything else to add to it?
I'd like to add that having those important conversations with your students before school starts, right? Seeing if they have anything they're apprehensive about, in fact, asking what are they excited about, like reframing and modeling open communication so that they are able to focus, right? Also, encourage extracurricular activities. That is a huge one for students, especially middle high school age, right? Trying to help them connect their education to something that they love and that they're passionate about will energize them. And like student athletes, right? Student comes first, making sure that they have a connection to the school outside of math, science, English, and history. And then last but not least, talk to them about healthy friendships. Social media has really changed friendship for our young people. It's not as healthy as it used to be, and we need to model that as adults and encourage that and support that, and making sure that they have a network, a safe network of friends in school that they look forward to seeing every day. It really does make a difference in their effectiveness and their efficiency and when it comes to their academic pursuits.
Alyssa, I see you came off.
I did, Stacy. I just wanted to add, providing a safe space at home is something that kids do need to feel confident and supported. And I just wanted to add, when a child is heard or feels safe or feel unjudged, that normally motivates them to be ready for school too as well.
If I could add one other thing to that, just really quickly, I forgot that, especially with our younger kids, kind of limiting screen time each night, whether it's video games or TV, and kids not having those kind of things in their room when they're trying to get a good night's sleep before. So just kind of, we talk about routines, and part of that routine being having the screen time be a certain amount of time, and set that and kind of sticking to it, because we see more and more of that with, if kids are coming to school tired and we know they're up at night playing video games or watching TV, that part of a routine can be really important.
I'm so glad Douglas said that, because as a parent of three who are now all grown, I will say I was very, very clear with boundaries when it came to their devices. They had to charge it in my room. And I don't think that's a bad thing. Like, because we know as adults, if we hear our phone ping at 2 o'clock in the morning, right, we may be tempted to look. And young people are going to be. So I strongly encourage charging those phones outside of their bedrooms, so that it's not a distraction. And it's okay. Like, that is truly okay. And if you don't feel comfortable doing that, most cell phone providers have screen time. Where you can control their screen time, where you can limit their screen time. You can narrow it down to certain apps. My son hated it, but it's okay. You have to be Like I said, I've said it many times, you have to model it, but you also have to help them set boundaries for themselves until they're able to do so because they're children. So I'm so glad Douglas said that. Screen time is a huge one, and we do see a lot of kids coming to school tired because they were up to 2 or 3 o'clock in the morning on their video games. So it's okay to take those video games out their room as well. There could be a common space where they play their games. The room should be a place of rest and sleep.
Hey, Rhonda, I see you came off. You have something you want to add to it?
Yes, but everybody has said everything just about everything that I was going to say, especially with that screen time and speaking positive affirmations before the child goes to school. I think that's very important in setting the tone for their day. So a peaceful atmosphere before they leave for school, and show interest in the child's conversation before they go to school. Because, sometimes we're getting busy going to work and the child is getting ready for school and they're trying to show us things and we're in a hurry. So it's very important to show interest in what the child is saying as they go off to school.
I love it because I was just thinking the same thing. So you guys, my background was multisystemic therapy. And so I used to be a clinician. And that was the one thing as I was helping parents help with the change of the behaviors of the child, right? We want to encourage change. But don't send them out the door just yelling at them and fussing at them, or depending on which culture and household, whooping them. That sets them up for a bad day. You're gonna send the kids with all this attitude or whatever to the schoolhouse. Now the teachers and the staff at school have to deal with those behaviors. So set them up with a good day, encouraging affirmations, those positive words. Awesome. I love it. I love what I'm hearing, you guys. Anything else that you guys wanted to add to that wasn't already said? All right, so I'm going to go to question number 3. And question 3 says, hold on, okay. Question 3 says, can you give us some examples on how to help kids handle stress and anxiety? We know that's something that we all have to deal with. So what tips can we give these babies? And I'm going to throw it to Alyssa.
Absolutely. I think every child has something that lights them up. I think every child they have something that makes them spark. And for some, it could be sports. For some, it could be art. For some, it could be something spiritual. And I just think that encouraging them to do the things that brings the best out in them can help them, um, decrease that anxiety and that stress. I know in my experience, I had 2 boys that played football, and I know that football was something that they loved to do. And so with all of the stress and anxiety, that they was experiencing, they would, when it's time to go to football practice, they would have them run up the hills and go back down and do all these exercises and different things. And that would help them, decrease some of the stress and anxiety that they was experiencing. But I want to say that what works for some kids may not work for others. So it's just a matter of finding what's the right fit for each child. But that's one thing that I did want to share, just allowing the child to experience what brings out the best in them. Could be just playing chess. It could just be a simple a quiet space or a quiet area that they just need to recharge could help them, decrease anxiety and stress.
Awesome. Does anyone have anything else to add to it? Which I thought she did an amazing job with, emphasizing finding their niche. What are the things that they're interested in, Douglas?
Well, I would just say too, and I completely agree with the exercise part. That's a tremendous asset when kids do that, and extremely healthy. And on the mental health side of things, when we talk about school, to let kids understand that there are people there that can, help them with different techniques and strategies to get them through a school day. If they can't go outside, or if they can't do that physical exercise, to whether it's a school counselor helping them, practice breathing techniques, or some sort of another classroom strategy or whatever, whatever the student may need. And also, to give parents resources on different therapists. Sometimes there's school-based therapy available, or just, our resource and network of our therapists that can help kids handle that in a therapeutic way as well.
I'd like to add to that. I know Lisa mentioned it earlier, like being a safe space for kids. Kids, life for them too, right? So kids do have stress and anxieties that they have to deal with in their environments. I think it's important for the adults in their life to be a safe space and to listen actively, not just listen, but listen actively to what they're saying and what they're not saying. And then ask them open-ended questions. Don't just say, "How was your day?" Because you might get a fine. Good, right? Asking them some open-ended questions that, how did it make you feel? Or things of things of that nature. Like dig a little deeper than just fine and okay. And then, of course, normalizing their emotions. Don't judge their emotions, even if like, girl, there's many, there's guys and a bunch of boys out there. Why are you worried about him? Like, that's minimizing their emotions, right? Listen to them actively. Don't minimize their emotions, and teach them how to regulate their emotions. It's okay to have feelings, but teach them how to regulate it. Help them identify it, understand it, and manage it in healthy ways. That is the magic of helping kids handle stress and anxiety. It's really creating safe spaces where they feel comfortable coming to you, and they don't feel judged, and you actually validate their feelings and teach them how to manage those feelings.
Yeah, I'm noticing our kids have some big feelings sometimes, some big emotions, and they don't always know what to do with their emotions when they feel them. So
Exactly.
allowing them to have that safe space, and things like that. Douglas, did you have something else to add to it?
Well, I just think from the school standpoint, or the standpoint of us as school employees, we create that environment, right? Kids have to have a reason to come through the doors. They have to have a positive reason to come through the doors. So for us to create that welcoming environment and that safe space and that comfort level, whether it's, greeting kids at the door or talking to them at breakfast or whatever that is, those little kind of interactions are going to lead to that comfort for them to come to us for bigger situations or a little bit more serious situations. So those little things can be extremely important in creating that environment.
So what I'm really hearing you guys tell me is it's not just a one-way street, that it's not just something that the parents or the caregivers need to do, but it's something that as the school staff is receiving the children, giving them that safe space and that ability to kind of be genuinely themselves. And if they're having some big emotions, accepting it and saying, okay, well, let's work through this together. And then allowing them those moments to have, whether it's after school things, or things that they just really gel with is their go-tos, the things that they enjoy, whether it's arts, poetry, sports, dance, whatever it is, allowing them that free time, that space to release some of those feelings through the things that they're doing, whether it's arts or any of the other things that I've just recently mentioned. And those are good ways to allow our kids to decrease the stress and decrease the anxiety, having those safe spaces, whether it's with the caregivers or school staff, or if it's with the coaches or, the teachers and things like that, and those extracurricular activities. Keisha, I see you came back off.
I'm just gonna say, and let's be clear, these children are not do what I say, not what I do kids, right? They are going to do what they see. So modeling. All adults in their lives should be modeling the behaviors that we're expecting from them. And how we handle our stress and our anxiety is the biggest lesson. If you're telling them one thing but doing another, you might as well not even waste your breath. So like they are watching us carefully, trust me. So please be mindful of that as well. Your modeling is the biggest lesson that you can teach them.
I find those stories there, setting the example, leading the way is definitely a good way to also do it. And it's not just put on parents and caregivers, but all of the adults that are part of the village, because we've always said it takes a village to raise a child. So if you have that village, then those different people definitely showing and leading how to express yourselves when you could become upset, and how to work through and handle your anxiety and your stress. Because like I think Keisha said earlier, life be lifing on all forms, whether it's for little people or big people. It looks different, but it's still something that they're dealing with, and not playing it down, and giving them that free space, that safe space to talk about it and to process it out, because processing is really important. Okay, so no more adding to question number 3. All right, so we're going to go to question number 4. Question number 4 says, what are some red flags that parents or caregivers need to be aware of? So if you see these, it's like, something's wrong. We need to have a conversation. What are some of those red flags? I'm sorry, I didn't throw it. Rhonda, yep, you was on it. Thank you, Rhonda.
I'm covered off mute on that one. Yes, when the child is appearing frustrated or fearful to go to school, even when someone mentions school, they seem to cringe, or, they just don't want to go to school for some reason. I had noticed for myself with my grandson last week. He had came home from school. Well, he had called me and said that his head was, I said, how was your day at school? And he said, my head hurt. And that sounded like, to me, he was avoiding answering my question. And something was going on that first day of school, so we discussed that. So noticing when they do get home from school, especially that first day of school, he was angry that first day. And pay attention when a child thinks someone is bothering them, because a lot of times we may brush that off. So I think that is a red flag. And how they come home every day, or if they're missing something. Say they went to school and they had a new pair of shoes, and they come home with somebody else's shoes on. Those are red flags that something is happening at the school. And again, communication is key there. So we have to have communication.
Definitely. Those are some pretty big red flags. Alyssa?
I just was going to add that a sudden drop in the academics, that's something that's a flag. That's something that you do want to take notice of when a child is having difficulty with, the teacher, or the academics have suddenly dropped really quick. That's a big red flag, and you definitely want to attend to that. Also, changes in their sleep habit. I notice some kids, there's a change in their appetite and sleep habits. Those are red flags that you do need to pay attention to.
Think changes in any of their behaviors. If your child is usually rambunctious and energetic, and all of a sudden they're not, right? Or the opposite could be a red flag of something as well. Also, if they're isolating, I know we kind of get no, we think it's normal for kids to want to be in their room and play their games and things like that. But if it's abnormally isolating, because isolation is not healthy, the itemize the devil's workshop. And so if they're isolating, if they all of a sudden they don't want to be around, they don't even come down for dinner, things of that nature. Like, you're always looking for shifts in behaviors. That's one of the things we teach our staff, right? We're looking for shifts in behaviors. It's always a clear sign that something is going on. And, we've talked a lot about mental health, but let's be clear, we have a substance use crisis going on as well. Children are self-medicating, right, to deal with life sometimes. And so you definitely want to pay attention to, what could be symptoms that they are been exposed to some substances. And so, watching your child, know your child. Nobody knows, a child better than their caregiver, than their family, or whoever their guardian is. Like, just pay attention to little subtle things. And it could be even their vocabulary all of a sudden, or the way that they carry themselves, or the way they dress. Like, it could be all kind of changes that could show you that something is happening. And I think Rhonda pointed out, bullying is a problem. Hurt people, right? And so we definitely want to be mindful to see if they're extra sensitive all of a sudden. It could be because they're full, or they're angry and they don't know how to process it. So just looking for any shifts in their behaviors.
And I would just add, obviously being the school social worker, I have to talk about attendance. If kids are starting to miss school or finding reasons to miss school or not wanting to go to school, that's a big red flag. And then if they fall behind, it's just a lot more stressful and for them, and they're not feeling that kind of sense of belonging at school. At the elementary level, well, probably middle and high, we kind of monitor how many times a kid might go to the nurse during the day too. So if you got a kid that's going down to the office, going to the nurse, several times a week, there could be an underlying issue there, and it may not be medical. It could be, the mental health side or anxiety. And then I encourage parents to, they have computer access, to monitor their grades, monitor what assignments they've turned in. And if they start to see a pattern where their child is not turning those things in, that can be a red flag. So just kind of be proactive and keeping up on what the kids are doing in school is very important.
I'm so glad Douglas said that, because that's one of the tools, all the way back to the first question, right? Like, get access to your child's information. Most of the districts, if not all at this point, are on Infinite Campus. That's our new software, totally away from Power School. We're now on Infinite Campus, and every parent can get access to their child, where they can see their attendance, they can see their grades, things like that. Don't let your school have to call you and you're surprised by anything, because we don't have that excuse anymore. We can have access apps on your phone where you can see everything there is to know about your child's academic and attendance, and even their behaviors. Like, get access to those things now.
And with the attendance, I mean, we've had parents that, they drop their kid off at school and then the students skipping first block, and the parents don't know that. But if they've
Come in
had
the
access
front door
to
and
the
go out the back
school,
door.
they can monitor it all.
I think one of the things that you guys just said was to be proactive. Let's not be responsive. I think that helps with not only just the tools and how to help them have a successful, energized, and focused day at school, but if we're being proactive on the front end, is what I think I'm hearing you guys say, and that'll help with the things that are to come, whether it's the behaviors, you'll have more positive behaviors or reactions or interactions with your kids and things like that. So if we're being proactive, and being mindful of, this is my child, I've known this child for however old they are now, and knowing their behaviors and the consistency that they normally have. So if anything changes, I think I heard you guys say, then that is a big concern. That's a big red flag. Another one that comes to mind, because remember, me and my clinical mind, is if a child stops taking the bath or the hygiene things that they were used to doing, and like, oh, my child knows to do this, this, and this. Somebody that you might not be aware of might be also touching them in an inappropriate way, which also can happen whether it's on school grounds or wherever. So just being mindful of the whole picture of your child. So if your child is one who loves to take their baths and smell good, and all of a sudden they stop caring about those things, they stop caring about how they look and how they're dressing, that's not only just for substance and things, but it could be something else. So just asking sometimes those difficult questions with your child, especially if you have that rapport with them, so that they can be honest with you and they know that they have a safe space to be honest when they come to you with those different things. Thanks, you guys. You guys are doing amazing. All right. We have a little bit more time, so I'm gonna have a few extra questions, and then we're gonna get to the questions and comments that might be coming in, and then I'll call on Beth in a moment. What advice can you give to parents or caregivers to support a successful school year?
I got 3. And they are so important, not just as an educator, but as a parent. Communicate with your children's teachers, right? Like, we had open houses this last week. Like, go to the open house, know who they are, get their email addresses, all the things. I think someone mentioned it earlier. Make sure your information is updated so they can reach you, but know your child's teacher. Attend the meetings, right? Like, come to the PTA meetings or the literature nights and things like that. Like, let your face be known. Come to the school. Don't just show up for picking them up when they're not having a good day. Like, make sure your school knows who you are. Get active. It does help. I promise it does. Knowing what's happening in your school being a part of the PTA or the athletic boosters, arts boosters, something to make sure that you are a voice in your child's school. And then last but not least, utilize the resources. There are so many resources that come through our schoolhouse every day. School-based mental health is one of them. Most schools have some form of mental health services, whether it's a staff member that provides mental health or an agency partnership like we have here in Forsyth. But utilize those resources. Check the websites, check the Canvas pages, all the things. Know what's happening and know what access your child has to certain things so that you can create a full rounded experience for them.
Melissa?
I'd just like to add one. I would just say you are the best advocate for your child. And I would say that those interpersonal communication skills are key, building a rapport, but building a relationship with the school staff, the teacher. I think that is key in helping parents and caregivers have a successful school year. And I think Keisha hit on it a little bit, proactivity, showing up, being available if you have time. I do know that parents do work and you may have a heavy work schedule, but just simply comes checking in for lunch, getting to know, the environment, the principal, it will all make a huge difference.
Definitely. Is there anything anybody else wants to add to the extra question number 1?
And I'm gonna say to high schoolers, as a high school counselor myself for many, many years, your school counselor at your high school is gonna be very important your senior year if you're planning on going to college. You want her or him to know who you are. Like, don't wait to senior year to try to build a relationship with the person that you're going to have to ask for recommendation letters from. Most schools and most scholarships are going to ask specifically from a letter from your school counselor because that is the person in the building who should know you. So I always try to tell freshmen coming into high school, build a relationship with your counselor. Lots and lots of scholarship and other opportunities go across school counselor's desk every day. Make sure you know who your school counselor is. It's extremely important at every level, but it is so important at the high school level. If you're planning on going to college or looking for a job, like, you are going to need that school counselor.
Definitely. Rapport, relationships is very, very, very important. Staying in contact, making sure your information is always up to date. Now that doesn't just go for schools. So if you guys have Medicaid and things like that, please make sure your contact information with them as well are up to date. It's very important. So if somebody's trying to outreach you, whether it's for medical, mental health, school stuff, just make sure if there's anything that needs to be updated, please update it. And also keep in mind, if you don't know where to go and the school's not quite sure, they don't have the resources in your county after school, Partners also has a provider network that we can search for different therapists that might be available for you or for your family in the county that you are in. So please don't think, well, I don't know where to turn. I'm giving you a little bit of advice. And I know they keep dropping things in the chat for you to have resources as well. So please, please, please reach out to Partners if you know your child or you, because you could be the one that needs some additional support for your own mental health. So please reach out. We can definitely get you where you need to go. And I'm going to give you that information in just a moment, okay? In just a moment, I'm going to give you what email address you can reach out to or telephone numbers you can call if you need that additional support. Last one, and then we're going to do questions from you guys. What role do community partnerships play in supporting students' well-being, and how can families engage with these resources? I don't see nobody jump off, so I'm gonna just throw it out there. Oh, okay, Douglas, gotcha.
Well, being a social worker, I always tell people I'm only as good as my resources. Families come to us, whether it's about mental health, whether it's about basic needs, whether it's food, clothing, I mean, all these kind of things. If I don't have good community partnerships with people, I'm kind of worthless. So, building those relationships with our community partners and our agencies and we're very, I think very fortunate in Cabarrus County. We have some tremendous agencies and resources that we're able to use. So, and a lot of times, families, we all know how difficult it is sometimes to make a phone call and get somebody on the phone and actually talk to those people or to that resource. So, we encourage them a lot to go through us, and we try to make a connection with a person, or make that referral or recommendation. And sometimes it may go a little bit more smoothly, but yeah, our resource is extremely important to our students and their families as well.
Awesome. That is a very good point. And I know I live in Forsyth, and so I know in Forsyth we've been working hard to build the rapport, whether it's with faith leaders and different things like that, because those are the ones who have that extra trust with those members that we might be serving, or the community in general. And so if we have someone that has that rapport, again, is very important. The rapport with your kids is going to be important. The rapport that we have as community people, right, with the different providers, so that when you trust us, and then we have somebody that we trust and we know that will care for either your student or for you, it's very important for you to feel safe to be able to turn to them. All right, if no one else has anything else to add, I'm going to throw it over to Beth for questions and comments that might have come from participants.
So we do have one, and it says, what can I do when the environment is not welcoming to my child? Teachers can sometimes be a bit too much.
Advocate, advocate, advocate. Adults aren't perfect, and so therefore, in life is life and for everybody. So if there is a concern about a staff member, there are protocols in place for that. Whether it be, a principal or, first and foremost, meet with the teacher, have a conversation with the teacher about your concerns, right? Because they are professionals and they do know that they are responsible for your child. So meet with meet with the teacher. And if your child is older, allow them to be a part of that meeting so that they too can voice their concerns. And then if you're not satisfied, then you go to the administration. That is the correct protocol. We know that sometimes there are mixed matches, personality conflicts, right? And so therefore you definitely want to make sure you're advocating and you're following the protocol to advocate for your child and make sure that they're getting the best education possible, for sure.
And Keisha said it perfectly. I mean, the advocating part is huge, but I also say this, that students need at least one or two people in that school that they feel comfortable with. If I have a student that's comfortable with coming to me, great. If they're not comfortable coming to me, they need to find somebody else that they are comfortable with, whether that's another counselor, another teacher, anybody. But to find that kind of go-to person, for your child is a very, very important thing. And that's kind of how those relationships are built. But I'll just echo what Keisha said. Try to have a conversation with that teacher first and foremost, and advocate for your student.
Alyssa.
I agree, advocating number one, but I also know that sometimes certain environments may not be a good fit for your student or for the child. So the advocating is very important, and sometimes you may have to make changes if possible, if you can. I know some situations, parents may not be always able to remove the student from that classroom, but researching, advocating, and just making sure that the child has a good fit, that the location or the classroom or the classroom is a good fit. And if it's not, then you may have to make some adjustments.
Awesome. I like how it's echoing similar things with having the rapport and then finding someone who is that safe person in the school. Awesome, awesome, awesome. And I see your hand up.
Yeah, I have a question. So what can someone or any of you give advice on having a kiddo at home that's screen time? They're all about screen time. And it's really hard to regulate screen time, especially middle school, teenage. Any recommendations on how to work with that negotiation? Where do we go with that?
From my experience, sometimes I'll do a timer. I'll start letting Levi know that you have about a certain amount of more minutes on the tablet. He likes to be on the tablet. That screen time, he loves it. And I'll let him know that maybe 10 or 15 minutes, we got to wrap this up. We got something else to do. And I'll try to direct him to something that I know that he does, something else that he likes, such as sports or something that he likes. So that's one strategy that I use.
The consistency, consistency, consistency. And sticking to your guns, so to speak. If it's time to get off, it's time to get off. Like I knew one parent that nothing was working. She turned the breaker off in the student's room one time at night. So on the other side, you do what you got to do, but just be consistent in your efforts, and it tends to make things easier over time. Not that they're not going to argue with you, but it's just big to kind of stick and say what you're going to do and then do it.
You took the words out of my mouth, Douglas. Like consistency is huge. Say what you mean and mean what you say, because children at all ages know if I get away with it once, I'm gonna get away with it again. If I push the buttons, if I, you know, aggravate them long enough, they're gonna give in. Like you gotta mean what you say and say what you mean. That is parenting 101 for me. Like you got to be consistent. And I said it earlier, and like literally, phones don't have to be in their rooms. Video games don't have to be in their rooms. You can set boundaries for them. The earlier the better. Don't wait till they're bigger than you to try to set up some boundaries. But like literally set boundaries and don't bend them, because you're doing what's best for them. You know that blue screen, first of all, is not the healthiest thing for our eyes and for our minds, for our brains. And I'm not gonna go there, but I'm just letting you know it's not. You can Google it. And then of course they can become addicted to screens, like literally addicted. There are some college professors that will tell you they're having a hard time getting 20-year-olds to put their phones down in class because they're addicted. They're so used to having it in their hands, they don't know what to do without it in their hands. So the earlier the better that we set those boundaries and create those spaces to reduce that addiction. Now we know it's a part of life, like there are going to be some seasons where they're going to need certain devices. I mean, we don't even have textbooks anymore in the high schools, right? Most of the things are on Chromebooks, but do not allow it to be a 24/7. And if you check their screen time, like I'm not going to give a shout out to a certain phone company, but the one that I have, like you can see their screen time for each app. Like you can tell how much time they are on TikTok every day. And if you see they're on 7 to 8 hours of TikTok a day, that is not okay. So just consistency, mean what you say what you mean, and set boundaries. It's okay. They'll be all right. They'll thank you later, matter of fact.
So we do have another question that says, what advice do you give or do you have for single parents with multiple kids to keep up with everything?
Jump in. I guess I can make some assumptions on the everything. I guess organization, of course, is key. I used to have a calendar on the wall with each child. I had 3 with each child's name on it. And every month I sat down and wrote. It was a beautiful thing. I can't remember the name of it right now, but like I bought it every year, the same calendar, because it had space to put their name in every day of the month, and I wrote down what they had going on. That was before cell phones, right? Were so big. So we went to Apple calendars where we shared, and everybody could see what was happening. So having some organization, especially if they're active children, right? When you say everything, like if they're active, and just like you keep up with doctor's appointments and dentist appointments and things of that nature, keep up with their extracurricular commitments and all of the things. I think it is a task, not trying to minimize it at all. It is a task, but organization is key. And also, it's okay to ask for help, right? Like, it takes a village. I'm gonna say it in Spanish if I could. It takes a village. Like, I know we've gotten away from it. We don't really subscribe to it as much, but my mother was a single mother. Like, there's no way she could have handled the life that we had without people that I call rams in the bush, people that was there to help support and pour into us. So be okay with asking for help and creating a support system around you so that you don't have to do it alone.
Go ahead, Rhonda.
Yes, I agree with Keisha because I was going to say that's a perfect time to utilize your natural supports. Sometimes we want people to think we can handle it, we have it all, and then when we fall apart, then the whole household falls apart. So we want to be sure to maintain our sanity, to be able to take care of our children. So utilizing natural supports is very important because when the parent is not well, the whole house falls apart. So it is very important that we call whoever we can call that's going to help support the children. Whether it's someone, sometimes coaches at the school, faith-based community, whoever it is that was there early on and think they're going to help. Utilize that help at all times.
Awesome. So it sounds like some key things to take away. Routine. Let's go ahead and get in a routine before they start school. And for those of you who have already started, getting them back in the routine if they haven't gotten in it yet, getting in the swing of things. Use your natural supports for different things. Finding that rapport, that person you have a really good relationship with. Those are some key things, as well as allowing the opportunity for them to get engaged in the activities that they can get engaged in after school. And so now, since there's no more questions, I do want to throw it over to Starla Jordan, as she is going to be on the panelist now. And she has an associate degree in business administration from Rowan Cabarrus County Community College and a Bachelor of Science degree in psychology from the University of North Carolina at Charlotte. Starla completed a 6-month-long internship at Broughton Psychiatric Hospital before accepting a position within case management at CMC Northeast Medical Center in Concord, North Carolina. Starla accepted a position as a clinic manager of an outpatient surgical clinic 7 years later and remained there for 5 years. Starla has also held a county license as a foster parent for 7 years and currently volunteers as a guardian ad litem for Cabarrus County. As of 2021, Starla works as a system of care community training coordinator for Partners Health Management. Starla also coordinated crisis intervention team training for law enforcement and other first responders in Cabarrus County. She is certified in youth mental health first aid and QPR suicide prevention. Starla has contributed multiple training presentations currently in use by Partners Health Management for community education. She's going to share one of those trainings with us now. Starla, you got it.
Thank you, Stacy. And the training that I want to share with you guys real quick is QPR, question, persuade, and refer. This suicide prevention training can be very informative for a lot of the red flags and everything that everyone has discussed here today, but not only about the red flags, but what to do and kind of what to say and the kind of, and learning to be that bridge for that youth who is in trouble, being that resource bridge for them to get them to the right help, and whether it's therapy or medication or a doctor or what have you. The good thing about QPR is that not only is question, persuade, and refer available as a training for adults, but we also have QPR for young people as well, for those middle school and high schoolers that we talk about, because I think like a lot of us already know, but just to kind of confirm, usually when an adolescent or a teenager is in trouble mentally or emotionally, parents are not always the first people to know, right? It's their friends. And so it's very important for us to get this information out to our young people as well as the adults. But we do those trainings in person and virtually, and we do them many times throughout each month. So I believe that my contact information, I think, will be available. So if anyone's interested in signing up for those, then just let me know and I'll be happy to help. Thank you, Stacy.
You're more than welcome, Starla. Thank you for joining us this morning, afternoon. even though morning is my
Afternoon.
favorite time of the day. All right, so next, want to be in the know? Give me just a few more minutes of your time. And I promise you we'll get you out of here. But I know if you have to drop because it is about to be 2 o'clock, I get it. This is recorded. But if you can hang on just for one more second, let me get through a couple more slides with you, and I promise I won't hold you long. So want to be in the know? Join our email news. Grab your phone, open your camera, and hover over the QR code, and then click on the link. Or you can just copy and paste from the chat, because I know Seisha put it in there for us. Once you do that, enter your information into subscribe, and then you get to choose. So you get to select what type of news you want to receive. All right? So please stay in the know with us. There's some important telephone numbers you might need to know about. I told you I was going to come back and give you this information. So for those who need member and recipient services, if you want one number, this is it. They can assist you if you have questions or straight to the specific number. So the number is 888-235-4673. This number is open Monday through Saturday from 7 a.m. to 6 p.m. This one is for Medicaid members, state-funded recipients, and stakeholders. If you have a behavioral health crisis, this number is for anyone. So if anyone is having a behavioral health crisis, please reach out to the behavioral health crisis line. The number is 833-353-2093. This is 24 hours a day, 7 days a week. And again, it's open to anyone. If you have Medicaid with partners and you need transportation to your appointment, so that's our non-emergency medical transportation line, the number for that one is 833-577-2309. That number is available and open for you all Monday through Saturday from 7 a.m. to 6 p.m. This one is for our tailored plan Medicaid members. However, if you have Medicaid, everyone has a non-emergency transportation line. So please look into that if you need to get to an appointment. Nurses advice line. So let's say I don't feel well and I can't get to the doctor right now, but I can call the nurse advice line. That is 888-369-2452. And that one is 24 hours a day, 7 days a week. And that's for our tailored plan Medicaid members. Pharmacy services. So you get there, they're saying something you ain't trying to hear, costs more than what you expect and whatever. The number for the pharmacy services is 866-453-7196. And this one too is 24 hours a day, 7 days a week for our tailored plan Medicaid providers, members and providers. If you need to have Teladoc Health, the website is there, and I know Stacia dropped it for you, but the number for that is also 800-835-2362. And that's just for our tailored plan members. And then for provider services, that number for provider services is 877-398-4145. And that is open Monday through Saturday, 7 a.m. to 6 p.m. That line specifically is providers. But again, if you can't figure out any other numbers and no numbers ring a bell, keep in mind that very first one, because that is an open door to any of the other departments that you might need to reach. So I'm gonna say it one more time just to make sure. 888-235-4673. All right, now, I hope you guys use those numbers. So on the next slide, the NC Medicaid Ombudsman Program helps North Carolina Medicaid and North Carolina Health Choice members understand the Medicaid program and changes happening as the state moves to North Carolina Medicaid managed care. Ombudsman services can offer help if people with Medicaid have trouble getting access to health care, and can connect people to resources like legal aid, social services, housing resources. We all know that there's an issue in the housing area, food assistance, and other programs. The NC Enrollment Broker is an unbiased third-party agency that provides information and enrollment counseling to beneficiaries. They help members choose a health plan, will mail notices and enrollment packets to members, and provide choice counseling and enrollment outreach. So there are the numbers listed there, and I know Stacia dropped it for you in the in the chat. So please reach out to them if you have any questions. Remember, if you have to contact your local DSS, those are different numbers, so you have to look that one up for your specific county. Your feedback is always important to us. We really want to know how we're doing. It helps for us to plan better future sessions and learn what topics interest you. Please take just a moment today. This is that survey I was talking about, only for 4 to 5 minutes to complete our survey. Grab your phone, open your camera and hover over the QR code, then click on the link. If your QR codes, they aren't for you, it's not for everybody, you can copy the survey link that Stacia just put in there, and then you can take the survey from there. And again, thank you for attending Member Cafe today and sharing your time with us. We truly appreciate it. As I mentioned at the beginning of our session, we have partner staff available for individual issues you may want to discuss. You can reach the member engagement team by sending an email at memberquestions with an S at partnersbhm.org. Again, I'm gonna say it one more time, but I know Stacia dropped it in the chat. Member questions with an S, partnersbhm.org. We appreciate you taking a few minutes to complete our survey, and our next Member Cafe will focus on bullying and social media. We look forward to seeing you then. Have a great day.